Welcome to the office of Dr. Richard Levin and babiesbylevin.com. Dr. Richard Levin is America's first tubal microsurgeon and has been featured on Good Morning America, The Phil Donahue Show, People Magazine, ABC, CBS, and NBC nightly news programs, as well as other media from around the world. Patients travel from all over the United States and from every corner of the globe to seek his expertise. Dr. Levin offers one of the highest success rates for tubal ligation reversals at an affordable price. Join us to find out why so many women refer Dr. Levin to family and friends, and how he can help you achieve your dream of having a baby.
With your post-operative orders, you'll see a uterus picture. It shows the tubes, the ovaries, the uterus, and it's just a diagram for me to let you know the lengths of your tube so that when you get back to the room and you're fully awake, you'll have a good idea of what went on. Generally, there are 6 figures. There's the right outer section of tube, and let's say you have 4 centimeters, we'll put a 4 up there. The lower part says right intersection. If you had 2, we would put 2. And at the bottom, then it says the total length, which would be 6 centimeters. We're hoping at the end of each case that each of the tubes will be 4 centimeters or greater, because at that length you get into the ideal pregnancy ranges with regard to length. That said, even women with 3.5, 3, 2.5, and 2, we have pregnancies that occur, but this will give you a bit of a heads up about how your case turned out.
It is important to drink lots of fluids after surgery, especially water and Gatorade. You can eat what you feel like, but we recommend staying away from heavy, greasy, and spicy foods. Take the narcotic pain pills that were provided as little as possible. They will cause side effects such as constipation and gas, which can be painful. It is best to take a non-steroidal pain reliever like Motrin, Aleve, or Advil somewhat regularly for the days immediately following the surgery. This will help you to avoid discomfort. Hopefully, you'll not need to use all of the narcotic pills. Please flush the extra pills down the toilet so that children don't accidentally get into them. For the first 48 hours, your judgment may be impaired by the anesthesia. During the first 2 days, do not drive a car, operate any machinery, or sign any important papers. For these first few days, you might also be dizzy and you may need someone to help you to and from the bathroom. If you have a fever of more than 100.4 degrees 2 times during a 12-hour period, contact Dr. Levin's office immediately and we will instruct you what to do. To avoid getting a fever, it is important to fully inflate your lungs and make a deep cough every 10 to 15 minutes for several days following your procedure. You should put a pillow on your belly and hold it firmly when you cough to decrease any discomfort. It is very important to follow these directions to avoid the possibility of developing pneumonia. If Dr. Levin specifically instructed you to avoid sex for a certain period of time after your surgery, it is very important to follow this instruction. For some patients, there is a risk of the tubes breaking apart just after surgery, so sex must be avoided for the instructed period of time to keep this from happening. Bleeding vaginally after the surgery is quite common. It is also common for your period to come earlier than usual or for it to come later after the surgery. You may also skip a cycle altogether. This is all normal. Please watch the separate video on incision care. Dr. Levin will discuss in detail how to care for your incision from the day after surgery until it is fully healed. It takes 6 weeks for the incision to fully heal, so you should not do any heavy house cleaning, lifting, or carrying of packages during this time. Do not do any heavy lifting for 6 weeks after your surgery. Do not drive a car by yourself until 10 to 14 days after your surgery. You should not drive until the soreness has diminished enough so that you can hit the brakes hard in the event of an emergency. Unless Dr. Levin has instructed you otherwise, you can start trying to conceive whenever you feel comfortable enough to do so. But there is no rush. Make sure that you take the time to let your body heal. If you think you may be pregnant, it is very important to let our office know immediately. We want to make sure that the pregnancy is not in the tube. Please send Dr. Levin short emails each week letting him know how you are doing. Once your incision is completely healed, you can stop sending these updates.